Hello, everyone. My name is Shelby Frazier, and I'm an occupational therapy doctorate student at Eastern Kentucky University. Today, I'm so excited to share my capstone project, which focused on developing an evidence-based animal-assisted therapy program to support school-based occupational therapy services. So, why animal assisted therapy? Animal assisted therapy has gained increasing recognition as an emerging intervention that supports physical, sensory, emotional, and social outcomes across various populations. Occupational therapy practitioners are in a unique position to integrate AAT into practice due to their holistic, client centered approach. But despite growing interest, there remains a need for a structured program development to guide the effective use of animal assisted therapy, especially in pediatric and school based settings. The purpose of this capstone project is to design a sustainable, evidence based animal assisted therapy program framework that enhances occupational therapy services within the Pineville Independent School System. This capstone aims to provide therapists and staff with practical resources, protocols, and service tools to implement AAT effectively. Project settings. This capstone project was conducted in two unique settings to gain diverse experiences in animal assisted therapy and its application within occupational therapy. The first setting was Island Dolphin Care located in Key Largo, Florida. This is a nonprofit organization providing therapy services to individuals across the lifespan with disabilities. The focus during this 2-week period was to gain hands-on experiences in how animals, specifically dolphins, are integrated into therapeutic interventions. The next setting was Pineville Independent School District located here in Kentucky. I work directly with children receiving school-based occupational therapy services. This portion of the project explored how AAT can be adapted and implemented in a school setting to support student goals. My project methods. I used multiple methods to gather insights and build this program, including shadowing therapists, animal handlers, and veterinary staff at IDC and Pineville School System. I observed school-based OT sessions to identify needs and barriers. I conducted interviews with IDC staff, school staff, and stakeholders. I participated in collaborative meetings to guide program development. And I also reviewed literature, policies, and best practices related to animal assisted therapy. Two major deliverables came out of this project. I hosted a community education event at my family farm in Tennessee for school participants, families, and staff to learn about animal assisted therapy through hands-on demonstrations and activities. I also created an animal assisted therapy program development binder with step-by-step guidance on implementing AAT in school-based occupational therapy. So, implications for occupational science and occupational therapy. Studies reinforce the growing need for occupational therapy practitioners to expand their knowledge of animal assisted therapy as a meaningful and evidence-based intervention within the OT scope of practice. The overwhelmingly positive student feedback highlights not only the value of animal assisted therapy in enhancing occupational performance, but also the gap that exists in formal OT education regarding non-traditional therapeutic approaches. As occupational therapists, we are uniquely positioned to advocate for the inclusion of courses like this within academic programs and continuing education. Doing so not only supports the advancement of our profession, but also broadens our collective understanding of innovative and diverse therapeutic settings. By advocating for education in animal assisted therapy and similar emerging practices, we foster continued growth, uphold client centered care, and ensure that our interventions evolve to meet the complex and varied needs of the populations we serve. In conclusion, this capstone taught me so much, not just about animal assisted therapy, but about leadership and advocacy within our field. I gained valuable experiences as both an occupational therapy student and a leader. I learned that animal assisted therapy is a powerful, meaningful tool that fosters connection, purpose, and motivation. I saw firsthand how AAT fits within the OT's client centered holistic framework. I strengthened my passion for advocating innovative, non-traditional therapies within schools and communities. And I also fueled my commitment to lead future efforts that expand access to interventions that truly change lives. Thank you so much for listening, and I hope this inspires you to think outside the box as we shape the future of occupational therapy together.